Welcome back to Open Line tonight. We're talking about heart health. It's February after all. You see hearts everywhere you go, but we're talking about your heart tonight and keeping it healthy so you can have a nice long life. I have Dr. Munoz from Vanderbilt University, also Misty Sharpe with us tonight, registered nurse and now an advocate for the Adult Congenital Heart Association. So glad you're both here. Thank you. We're always taking your calls here on Open Line. 615-737-PLUS is the number to call if you have questions about your own heart and how you can take better care of it. Dr. Munoz, you have been here about 5 years, you said. And it's a good thing you're here, right? Here in the South, because we need some heart education. We need some heart help, particularly here.
That's right. So, heart disease is a worldwide challenge, but there are particular corners or parts of the world or parts of this country that are particularly affected. Yeah. And we in the South are sort of on the 50-yard line of heart disease. And so there's a tremendous opportunity in Nashville and Tennessee and in the South to really take advantage of the knowledge we have and help people live healthier lives. We talked a bit earlier in the hour about the importance of diet as an anchoring principle of an approach to health. I think the other piece that I would add that I think is relevant to where we live in the country and to the patients I take care of every day is the importance of activity and the importance of exercise and getting out and really getting your steps in, so to speak, every day.
You said a phrase that I won't forget. Sitting is the new smoking.
Yeah.
That's a pretty big deal.
It's a big deal. It's a little provocative, but purposely so, because the flip side of that statement, that sitting is the new smoking, is that activity is a really powerful lever that we all control to really try to prevent the development of heart disease.
And that doesn't mean that people have to go out and be a marathon runner, right?
That's right.
What is a good level of activity? Yeah,
so if I could write it on a prescription pad and hand it out, I would. What I tell patients is that whatever you do, engage in something 4 to 5 times a week for 30 minutes at a time, if your busy schedule permits. And it's just got to be something that gets your heart rate up, whether it's walking outside or on the treadmill, whether it's the elliptical or swimming or biking, whatever is the least boring to you that you can do. Podcasts are helpful, or whatever you need to do.
I do that very thing.
Just so that your heart gets used to regular cardiac fitness. It also helps the blood vessels in general. There are any number of benefits to it. And so what I tell my patients often is that you don't have to win the race, you just have to run in it.
Yeah. What actually happens to our heart when we get our heart level up? What is the benefit?
So there are a couple of benefits. So the workload of the heart is a muscle, and so the more it's used, the stronger it stays. And so it becomes conditioned or tuned to that degree of activity and sort of builds its own reserve, so to speak. The other important thing connected to your heart is sort of the health of your blood vessels. And so blood vessels during exercise both contract and relax, and having blood vessels that stay flexible over time is really important and helps to prevent the hardening of arteries, higher blood pressure, and some of the processes that we know can accelerate the development of heart disease and blood vessel disease. And so it's exercise for your blood vessels as well, and any number of other mental, spiritual, and physical benefits. And so it's just a really important anchoring principle in the prevention of heart disease.
Got to get moving.
That's
Just got to do it. That's part of it. Misty, I do want to talk to you about congenital heart defects some more. And congenital means you're born with it, basically. Starts for some folks. They know about these in their children before their children are even born because of ultrasounds. And we get excited about ultrasounds because we can find out boy or girl and that sort of thing and see our baby for the first time. They're doing cute things. There are also very serious things that you should be asking during these ultrasounds, and the heart is one of them, about the heart, right?
Yes. Yeah, absolutely.
About the 20-week ultrasound is where maybe you can start asking those questions.
Yeah, absolutely. And certainly there are some defects. I mean, you have to think about that the infant heart is so tiny, so it's not foolproof to always be able to diagnose everything beforehand, but certainly you want to know, does your baby have 4 chambers? Do all of the connections from what they can see look like they're in the right place? Is the heart in the right place? And I think that that would be a good thing to tell most families, because certainly even more complex defects can be diagnosed after birth, and it just completely changes your life. I know there's a lot of conversation about would you want to know before or would you not, and I think especially with more complex, certainly maybe being prepared beforehand would would be good.
Sure, because some of these babies with the more complex congenital heart defects will just like you, will have open heart surgery within days or even hours of being born.
Right.
And doctor, tell me, I think that one of the doctors, when our son was going through all this, he was getting ready for his first surgery, and they said that an infant's heart is the size of a strawberry.
That's right.
The size of a strawberry,
That's
and
right.
they're operating on this itty bitty thing.
That's right.
Wow.
Yeah, and I think one of the things you said warrants emphasis, which is, you know, nobody's excited to operate on a child who's so small and so vulnerable with the heart the size of a strawberry. And I think part of why it happens, importantly so, is there's the recognition that delaying certain procedures can have really powerfully negative consequences.
Yeah,
and so
sure.
it's there's a lot of gravity that goes into those decisions, obviously, and it's important to be at a specialized center for that sort of thing, if you can be.
Yes.
Yes. But it just really brings home how big a deal it is for that particular infant and, of course, their family.
Oh, absolutely. And I can just say, and I'm sure you've had this experience as well, and your parents have had this experience as well, but we are eternally grateful for the surgeon, and you know, who has decided to go through all of this extra schooling, the expense, the energy, the knowledge required, the sacrifice, personally, professionally, to do this, and then to say, I will operate on children because of the emotional toll that it can also take. And so we're just like, thank you, thank you, thank you. And it doesn't seem like enough when they've saved your child's life, but we're so grateful that doctors have chosen to do that.
I might just say that as grateful as you are, I promise you that surgeon, who I don't know, his or her reward is exactly what you just articulated. That goes a long way, and so it's why we go to 30 years of school or whatever it is. So just know that that's a very big deal.
It's very important. I mean, I choke up talking about it because we have our son because of that. You have your life because somebody decided, I want to do this. You know, this is my life's work. So very important. But, you know, as in our case, we didn't know our son had anything wrong with him until his 1 month checkup with our family doctor. And she said, I hear a heart murmur. Probably not a big deal, but let's go to a pediatric cardiologist and find out. And they started doing more tests and more tests. And my husband and I looked at each other and thought, this isn't good. And he said, no, you need, you know, this child needs surgery. I'm like, open heart surgery? Yeah. I mean, just floored us. What are the tests done in hospitals, or your baby should have done before you leave the hospital?
So in most states, there is now pulse oximetry testing. Here in Tennessee, that is a requirement that all babies be tested via pulse ox. And you have to, normal blood oxygen saturation is 92% and above. And I want to say that I think babies have to be 95% and above to pass that testing. So that's one big thing that definitely is done before babies go home. You know, certainly when we're talking about testing for heart defects and stuff, there's echocardiograms to look at the structure of the heart, EKGs to identify. They can tell us kind of more about the rhythm of the heart, and can also sometimes indicate if there might be a structural issue as well.
Sure. And then perhaps once you get that diagnosis, one of the great things around here, a lot of resources to tap into, which I learned when we moved here. A lot of different groups, whether it be on Facebook or different associations. Can you tell us about some of those?
Sure, sure. So with the Adult Congenital Heart Association, we actually have an online directory. So there are a handful of cardiologists who are ACHD board certified. Now certainly there are many more that are board eligible. On that same note too, there's also ACHD programs. And so I think that's a really important thing for people to know, is that there is this resource that you can go to by visiting www.achaheart.org and looking at that resource to be able to find where a program is in your area. I think you know, some of the other resources is education. You know, just kind of preparing yourself with as much education as you can, and certainly a lot of organizations do that and are very very adamant and just as passionate about that. Certainly on our website we have webinars on different defects, and for the most part they are geared more towards the adult with CHD, but I think certainly there's a lot of information on there that even parents of young children would find beneficial, especially when they're just trying to kind of learn more about this new community that nobody
Yes.
wants to be a part
Well,
of.
exactly. You hear it and you go, what was that term? And okay, now I have to learn so very much about it. Misty, you mentioned something earlier that was very interesting. I think it probably plays into your role now. There are more adults living with congenital heart defects than children at this point. I think that's what you said.
Yes.
So how does this play into what you see every day? Are you seeing people come with heart defects, or people who maybe didn't know as children they had one?
Yeah, so all of the above. So we certainly see adults who, for whatever reason, were not diagnosed as children, either because they have milder forms or because they didn't benefit from the very sort of checks that you nicely summarized. What we see more commonly are adults who have survived their surgeries and their care for their congenital heart disease and are now living as adults, many living full, happy, active, vigorous lives. And you know, if you didn't know otherwise, and if they weren't reminded by the scar on their chest, they might not remember that they went through something. And the key there is actually something Misty brought up earlier, which is that in order for patients to continue to live their active lives and vigorous lives, it's important they be plugged into the right care. And so at the very least, an adult cardiologist, but I will even confess as an adult cardiologist that there are certain forms of congenital heart disease that I rely on my congenital heart disease colleague experts on. There are no points for toughness or ownership here. It's just making sure that the patient's got the best care. And so because we continue to learn more and more about what patients require to stay well after their flurry of activity in terms of their surgeries at a very young age, being plugged in with the right specialist, as you articulated, is really important. Because we're learning more and more every day about what the longer term considerations are, right? So one of the great things is that we get the chance to think about long-term considerations.
Yeah, it used to be not the case.
Right, and so that's great. We just need to push that to be even more great in terms of the depth of our understanding.
Because basically these people will always have a heart that looks, sounds, works a little bit differently than the normal heart,
That's right?
Yeah.
That's right.
It's not the textbook heart, never will be.
That's right.
Yeah. I think one of our doctors said, your son's heartbeat will always be different than the normal heart, which is kind of mind-blowing in a way, but it's like, you know, just listening to it is the signal. It's different.
I was definitely the guinea pig in nursing school when it came to listening to abnormal heart sounds.
Yes,
I can attest to that.
We have a caller on the line. I do believe it's David. David, are you with us?
Yes.
Hi there. Go ahead with your question.
Well, it's long and complicated. I have junctional epidermolysis bullosa with Weber-Cockney syndrome. And I have a couple of unruptured aneurysms on my heart somewhere. And I was born at Vanderbilt, and I'm an anatomical donor at Vanderbilt. And back on August the 17th, I had a heart attack about 11:30 in the morning. But I didn't go to the Vanderbilt about it until about 4 p.m. August the 18th. And they did a double angioplasty on me, and it was an immediate failure. And I've got the piece of paper that I was given whenever I left the hospital. It's got a bunch of stuff on there that I don't understand. But I'm number 6 of 7 children, and for some reason or another, I was the only one singled out that would never have health insurance once I turned 18 in '76. And when I had my first job, I used to have to take a polygraph test. And Major Jack C. Bolin, who was later the founder of the TBI, wouldn't let me take the polygraph test because every time I did, he said I have a bad heart from the day I was born. And I screw up his machine every time I take the test.
That's interesting. I never thought about that with a polygraph.
Yeah.
Very interesting. Wow.
But anyway, so how long could I have waited to have gone to the doctor and survived if, like I joke, that the angels of death, instead of harvesting me, they actually protect me? Because if you look it up on the internet, if you have junctional epidermolysis bullosa, you have no life expectancy. They told my parents I wouldn't see 18. They told me I wouldn't see 30. And when what I call the gates of hell lines up with a calendar on the last Sunday of this month, I'll be 60.
Wow. So I assume you did not know you were having a heart attack back in August.
Oh, I knew.
Oh, you know. Well, why did you wait?
If you remember, when you first came to town, I thanked you the next morning. You came to town about mid-August of,
yes.
the late August of 2015, didn't you?
You're exactly right, yes.
Okay. I thanked you the next morning for allowing me to light the Bar Association and the organized criminals called criminal court officers on fire.
Oh.
The brutal, honest truth about the criminal injustice system in our state. I'm going to have to breathe a minute here. And because I suffered for 24 years with an unresolved grand larceny against me because the state of Tennessee refuses to tell the FBI the outcome of non-conviction, non-plea bargain cases. And at year 23, 1/2, and 26 days, the Metro Police put me on the Patriot list because one day I would go through a firearm transfer and then I would know the truth about what turned my God-given gift and my little chances at life and happiness into the curse that it is.
Mike, just because we're running short on time, I'm going to circle back so we can get back on the heart health topic, okay?
Okay.
And I just want to ask the doctor about what your question was, is, you know, gosh, this sounded like a pretty dangerous thing to wait this long if he knew he was having a heart attack. I can't imagine that's advisable in any sense. How can you survive that? And then what is your sense to people to know that they're having a heart attack?
Yeah. So a couple good questions there, and I think Michael's grit and determination sort of shown through there, and he's a survivor of a tough disease. So one of the key things that stuck out from his story there that translates into an important lesson for all of us is that if you feel something, say something and get help. So when it comes to, particularly when it comes to any concerns about a heart attack, and we can talk about some of those classic symptoms in a moment, time is muscle, as we say. And delays in care can translate into a higher danger and a higher chance of death from a heart attack, which is obviously something we all want to avoid. And so part of what we're trying to do in an education-based, sort of population-based way is to get the word out about what are the symptoms of a heart attack. Because if you feel them, you need to get to medical attention.
And I'm going to cut you off right there because we lost your mic. But when we come back, we're going to talk about those signs and symptoms. I do want everybody to hear that, because if we get nothing out during this hour, I want you to hear that just for the very reason that Mike called in. So we're going to take a quick break. We'll fix that up. We'll come right back.